Hello, my name is Michael Purificato, and today I'd like to talk to you about a few different occupations, namely feeding and meal preparation. So basically, feeding is the setting up, arranging, and bringing of the food or fluid to the mouth, also sometimes referred to as self-feeding. And meal preparation is basically the planning, the setting up, preparing, serving, basically a well-balanced, nutritious meal. Um, so basically, that is how the occupational therapy framework defines those two different occupations. Feeding falls under the activities of daily living, whereas the meal preparation falls under instrumental activities of daily living. So basically, I'd like to also reference a client that I've observed too in the hand therapy setting. Now, she was a stroke patient, and she also had a little bit of hand deformity from osteoarthritis, and that also would basically affect numerous different occupations for her. So she did find it very difficult to feed, self feed, basically prepare meals, as well as different occupations. But today I'm going to focus more specifically on the feeding and the meal preparation, namely through showing you how to prepare a sandwich. And then I also have some other tools that I think, will basically help modify the occupation for someone like her who basically struggles with that, who has some weakness and also with range of motion and stuff like that. So basically, I have a jar of peanut butter right here. Now, for someone like her who has weak grip strength, this is pretty hard to open this lid. I mean, especially if it's sealed pretty tight. Um, and this is a heavy jar to begin with, but typically this would be a smaller jar. Um, so anyway, someone who has difficulty with opening a jar like this could really benefit from different devices that could actually, help ease the process. Um, I also have some juice here too, which would come in handy in a nice meal like that. So this cap is a little bit smaller. So basically, I kind of just made a homemade device here. It's basically just a tennis ball cut in half. And so someone like her, I mean, there's also different products on the market that are actually more specific to these different things. But anyway, so I have a device right here that I kind of self-engineered, but this actually helps with the grip strength here a little bit. So for someone like her who has weakness, she could really benefit. Also, when it comes to making a sandwich too, someone who has weaker grip strength and as well as deformity in the hands, they have very trouble with hand motion and articulation. And with the weaker grip strength, it's harder for them to maneuver a utensil like this butter knife here. So, it might be harder for them to actually spread the peanut butter. So basically, I'm going to go ahead and open this. So just take some peanut butter. So I have my bread here too. So basically, I'm going to just spread some peanut butter. So someone like her would have more difficulty doing something like this. So a utensil that actually has a very wide grip, they do make some on the market. I'm sure that you can also adapt it and self-engineer that, but a utensil like that would also make the process easier for someone like her. So basically, with this feeding, this making a sandwich, basically what an occupational therapist would do would go in and adapt that process. So they would actually just help her make it easier to use that. Um, So basically, someone like her, client factors play a big role in the therapeutic process because someone who has a stroke, has osteoarthritis, that's kind of like a double whammy. Those two can really affect your hand motion, your articulation. Um, and someone who had a stroke too could also suffers from fine motor skills, poor fine motor skills, basically. So it's harder for them to move and do other things. But like I said, the articulation is the big thing here. As well as the client factors also include strength, which she did have some weakness in her grip strength. So from what I've observed, it's hard for her to hold many things, other stuff like a hairbrush too. Um, and basically, the OT would actually use an intervention plan and go in and find a way to help ease the process. And some of these tools can actually fall under that. Um, but if the occupational therapist isn't able to necessarily dive right into that right away, they can use simulated or contrived activity, which can include not even necessarily holding the butter knife here, but it can be actually just maybe going through the range of the motion of spreading it, the peanut butter on the bread. Um, and what an occupational therapist might do with someone like her, who's a stroke patient especially, is they would basically go through purposeful activity, which would not necessarily focus on the difficulty of the process. It would more or less just um, it would more or less just focus on the inherent goal of making a sandwich. So basically, the end result rather than the process itself, which would help the patient be able to go through that, a little bit easier because, it might give them a little bit more motivation. And also, they also might use an activity analysis, which would just basically, take her through the whole process step by step, basically kind of like a guide in helping her with the occupation. So just basically, picking up the utensil, then putting the utensil in the peanut butter, then putting the utensil on the bread and then spreading it. So like very detailed, step by step, a little bit slower that instead of just jumping into it, because someone like her would have trouble just picking up a utensil and just trying to do that right off the bat. So, like what I mentioned before, adaptation, that's probably for someone like her when it would come to an occupation like this, where self feeding and meal preparation, um, adaptation would probably be one of the most important things. Basically, adapting the activity would help the client perform the occupation or the activity in the best, easiest way possible for them, basically at the highest possible level of function. And like I mentioned before, like something like this is an assisting device. Something like a wide grip or wide handled utensil can also fall under an assisting device. because it's helping her assist in the process of the occupation of feeding and meal preparation. Whereas, if she were to do that normally, she would have a lot of trouble. Another thing that I noticed working, basically, being in the hand therapy setting, is the use of orthotics, which the OT that I volunteer with, she does use orthotics a lot, and she makes numerous sprints for different types of patients who have different types of diagnoses. So basically, that's what I've noticed. So splint's very important for someone who like her who's suffering from a stroke. That's something that you would see a lot. So I hope you've enjoyed this and learned a lot. Thank you.